Today I am reading from the book Spirit of Homeopathy, book written by Dr. Rajan Sankaran, Mind section, chapter number 38, Homeopathic Psychotherapy. I recently conceived the idea of giving the similar stimulus through word and the image instead of medicine. I put it into practice with very encouraging result. By itself, it is a logical consequence of our understanding of homeopathy. But even more, it helps us to sharpen our method of understanding the core of case. In order to examine the idea of homeopsychotherapy, we have to ask certain fundamental questions on how exactly a homeopathic medicine acts. What we know about the action of the homeopathic medicine is that it produces a state of being that is similar to the state in which the patient already is. And such creation of similar state proves curative. The idea of homeopsychotherapy is that by producing a similar state through words and image, it is possible to produce a curative reaction of the vital force. We should first know that a state of mind produced through homeopathic medicine can be produced through other means of communication as well. Similarly, such state can be created by our talk, can we not use the in lieu of medicine. To do this, we must confront the patient with an image of his own state, which is similar to his central feeling, so that the person sees through his mind's eye the image of his exact feeling. We can do this by taking his case first and then throwing back his basic feeling to him. We already know that a remedy which has the basic delusion from which the whole state arises will act curatively. The way delusions from which all his feeling and action arise, if brought home to the patient, may achieve the same result. Once a person appreciates his own delusion, this begins to work on him like a homeopathic remedy. Under label homeopsychotherapy in practice. Now taking a case. Now I came to the actual process of administering this therapy. As is usual in homeopathic practice, the case is taken in maximum possible detail, especially with regards to the mind. We have first to understand the situation of the patient, his background, his occupation, his family life, social relation, his culture and economic status, as well as his childhood environment, etc. At the same time, we also observe how he has reacted to this situation around him. This observation about the patient in the course of the talk in the clinic itself are very important. The way he expresses his feelings, whether he is excited or dull, weeping or cheerful, slow to answer or hurried, mild or vehement, should be careful noted. With all this information, we have to use our human understanding and ask the following question to ourselves. What are the patient's conditions for feeling okay? Means at peace with himself and others. And number two, what are the basic feeling about himself or his situation that necessitate such condition? And number three, what are the other expression of such vision of himself in terms of his feeling and action? The whole process of finding out the patient's delusion means his perception of the reality need not to be a quick process. Surely we should try to avoid guesswork or putting the patient into the ready-made theory or remedy picture. The process should be gone through gradual and each step should be confirmed by the patient. The example, the physician keep his mind on all the time knowing that he could be wrong. He may begin with some idea, but there should be a great flexibility in his thinking so that he can change those at any stage of case taking based on his observation and the patient's response. Step by step, the physician helps the patient advance to find out what are the conditions that he has to fulfill in order to feel okay. What does the patient feel about himself and his situation that make it necessary to have this condition? And how has the feeling influenced his whole life and activity including his job, relationship, social activities, etc. At this point, the patient will realize to some extent and that condition he has to create are in response to his perception of reality, and often this perception of reality is far too exaggerated. For example, he can see that his whole activity resembles a man being chased by a lion, but actually it is not. It only a dog, and that is chasing him. Exposure to such an image automatically creates the whole mood of that state, which is similar to the state he already is in. This experience proves as effective as a homeopathic remedy for the simple reason that it is in fact the homeopathic remedy through word image. Now an example, we can look at this case of a woman who came with the problem of abnormal behavior caused by her depression, such as slapping her husband and other action which necessitate the psychiatric treatment. In this case, I went into the history in detail and discovered that all these complaints started after her marriage. The situation in her home was that she had a sister-in-law who got along much better with other in-laws. The sister-in-law was an extrovert, more beautiful, and fact was a model. Our patients felt inferior and developed a severe not okay feeling about herself. I went on step by step to find out her condition for feeling okay. The prominent things that emerged was that he wanted to be like her sister-in-law. And the statement which was going in her mind was, I will be liked and cared for only if I am like my sister-in-law. From this feeling, she tried to imitate her sister-in-law but was unsuccessful. And from this failure, she became depressed and developed abnormal behavior. What is more significant is that in this process, she failed to develop her own potentiality. I spoke to her husband and found that he cared for her as she was, and he did not feel the need for her to be like a sister-in-law. So the patient was now confronted with her own perception, delusion, that she had to be like her sister-in-law to be loved and cared, only while behaving like this way. So while in reality this was not possible, not necessary, and it was the delusion, means her false perception, that left her no choice but to be depressed and hate herself. When exposed to the difference between the perception and reality, the patient agreed that she could see the some extent that her feeling was too exaggerated for her situation. This exposure to her delusion acted effectively. After this, she was advised a simple relaxation technique to be a practice for a few minutes every day, and was sent away without any medicine or even a placebo. The whole process took around 2 hours. A week later, the patient reported a marked amelioration of her state. She could now shift back from her parents' home to her husband's and was able to face the situation much better. She could now look at herself more positively and decided to take up some work that suited her talent. This change was significant since we had discontinued all her psychiatric medication. Her husband happily confirmed that the improvement is there. Incidentally, in this case, if I were to prescribe the homeopathic remedy, I would have chosen lac carinum on the following symptom: contemptuous for herself, anxiety from doubt about success, delusion says looked down upon, delusion says diminished short, confidence want of self, delusion despise that she is, sadness, mental depression, undertakes many things and getting nothing. Now another case, undertake many things, And another case, my second example involves a young man of around 20 years. He was referred to me by a colleague who had treated him with some remedies without much success. His main problem was tremendous depression. He wrote in the questionnaire that I am an unhappy person. I don't know what is joy. The most of the questions he answered is like I don't know. He was withdrawal, completely pessimistic, and had made some attempts at suicide. We went through his situation in life and found that he was the only son of the businessman and had 4 elder sisters. Being the last child and the only son, he was highly pampered and overprotected. At the age of 15, his father suffered a heart attack, and boy was suddenly called on the shoulder of responsibility, something to which he was not used to do. The boy who was already timid became extremely nervous and felt very lonely. He became chilly. His hand became cold and had several dreams of his father dying or business crashing. With this feeling, he could do nothing and went into the depression. In this case, we try to examine his basic feeling or basic perception of reality behind this feeling. It was a difficult process because the boy could not distinguish between the reality and the delusion. The sicker a person becomes, the less he is able to discriminate between delusion and reality. In fact, one can say that this is the real measure of sickness. In spite of this, I try to expose this boy to his own delusion. The feeling of delusion was one of incapacity to face the problem and risk involved in business. He felt he was lacking, not equipped to face the big hurdles in the business, and therefore his response was to do nothing. Since he was lacking in confidence and he could not do anything about it, the only way of survival for him was to sit back and do nothing, be depressed and have suicidal thoughts. He was like a lame person who come in front of a mountain which it imperative for him to cross, and he knows he is totally unfit and lacking in ability to climb it. He feels that even a small stone can topple him and he will fail. So he sits back feeling inferior, depressed and scared to death. In reality, the situation was not so severe. The boy was brought to the realization that he was behaving like a lame man in front of mountain, but he was neither a lame nor was there is a mountain in front of him. After this discussion, the boy was given placebo and asked to report after a week. A week later, the boy reported an initial aggravation for 2 days in his whole state, with several memories of his past coming back to him, and this was followed by relief. This sounded to me like a homeopathic aggravation, almost as if I had given a potency higher than was needed. After another week, he reported that he was not feeling so good, but on looking at him, he seems better, and this time he was more open to my words. Also, his watch was missing. Here, I must mention his watch, which had observed when I saw him first. It was a funny watch, which had on its dial a spider web, and on one hand of the watch was a smaller spider which went round and round. The boy mentioned that he liked this watch and the spider because the spider represents to him a creature that does not give up even if it is fails. The third time he came to me, I reinforced the talk, and just as if I were repeating the dose, I feel it and sent him away. When I last saw him, he was significantly better despite the situational problem. For those interested, my prescription for him was for a surinam based on the following symptom. Delusion, he is poor. Poor means lacking in something which could not be money, but it may be strength, talent, courage, etc. Fear of poverty means fear of losing something. Fear of failure in business. Despair of recovery means coming back to the original sound position, whether in a business, health or any loss. Now another rubric was suicidal thought for second feeling, element from anticipation, anxiety with a fear, anxiety about future, delusion he was going to lose his fortune, doubtful about recovery, discouraged, fear of misfortune, fear of disaster, indolence, aversion to work, sadness, mental depression, etc. Now under label homeopsychotherapy and question of potency. Now where is the question of potency more clearly solved than in homeopathy psychotherapy? First of all should understand what we means by potency and what are the quality of the high and low potency. Potency is the power of the substance on even though force to bring about change. The potency of medicine is its inherent ability to bring about the change in the state of health. The power increases with the potency. The higher the potency, the more intense influence it can have. The lower the potency, the less intense in the effect. Now we should know that the more intense the central disturbance is there, the clearer the mental state will be there, and the clearer the mental state, the more intense the delusion will be. Therefore, the higher the potency of the drug, the greater is its power to produce such an intense state that the prover can distinguish to lesser and lesser extent the difference between the delusion and reality. The lesser the potency, the milder and more vague mental state, and therefore more the difference between delusion and reality. So lesser the lesser dose and in a less delusion state. Similarly, when we talk about the homeopathic psychotherapy, we can say that we have administered a higher potency of the therapy. If the patient got a very specific and intense vision of the delusion, we can say we have administered a low potency of the therapy. If the vision is less specific and more vague description or only a general idea of the delusion rather than specific intense experience, this is obvious since by definition. This is obviously seen by the since by the definition, the higher the potency, the more intense in the change in the state of the health it can produce. As we proceed in the process of therapy, we will find that depending on the intensity of the state is in the patient, we will have to modify the potency of our therapy. A person with an intense state is hardly going to be influenced by the low potency of the therapy. We will have to take a potency higher and higher until we reach the level where he shows some reaction. We have to stop at this point and let him go, because more intense experience could cause unnecessary and sometimes unsafe aggravation. In fact, the beauty of the therapy lies in this, that we can modify our potency on the spot and slowly increase it to the desired level. The reaction can be seen instantaneously. Thus, this therapy score over traditional homeopathy in the way that potency selection and remedy selection reaction can be properly modulated and controlled, and the reaction can also be seen on the spot. Going back to the two example I gave, we can see that in the first case, I did not use a specific image for the delusion of the patient. I merely gave a general idea that she felt she had to be like a sister-in-law, to be loved and cared for, which in reality was not correct. This itself was sufficient, since her state was not so intense, and hence she could at once see the difference between the delusion and reality. In the second case, I had to give very specific and intense image, since the boy was quite deep in his state and would not have responded to a general description as in the previous case. Now, under label advantage of homeopsychotherapy, I should mention here the major advantage of this therapy is that it can be administered even though we may not know the remedy homeopathically. Secondly, it is possible that a remedy for the exact condition does not exist. For example, we may find that it is patient there are some specific condition for feeling okay. We may discover the delusion. For example, his perception of reality that led to this condition, but we may not know the remedy that has this type of delusion. Maybe such a remedy is not proven enough for us to know its delusion. Here we can administer the therapy with the success. Of course, this therapy is not so easy. It needs skill and art. If you administer the therapy wrongly, the patient will immediately reject it. Worse still, he may accept it and get the wrong label, which can be very difficult to remove. Circumspections and fact are required. Even though homeopsychotherapy was initially conceived as a giving an image to the patient, I have found it advisable to merely guide the patient into himself, to merely point out his obsession and compulsion, to ask just very brief questions at the right point, so that patient tell you his deepest feeling rather than you telling him. This way, fewer mistakes are made. The physician stands back supporting the patient and leading him to the point of awareness. In the case of children, we have to devise other techniques like telling fairy tales and stories and watching their reaction. In much smaller children, pictures and movies could be tried. We will have to develop this technique. Every homeopath will well advised to try, understand and apply this therapy, even if he does not apply it in the individual case. The very process of taking the case and reaching the core of the mind will sharpen his skill and enhance his understanding of the mental state of the people, an ability which is essential in finding the simillimum.